Hello again, this is Alec with Home and Rehab, and today we're going to discuss ankle-foot orthoses. This is a special kind of orthotic that we use with people with unstable joints in the lower extremity, especially with neurological conditions like stroke and Guillain-Barré. One of the issues that we see commonly in things like this is something called drop foot. This is when, as you attempt to lift your foot up off the ground, it dangles, rather than maintaining in an upright position that prevents you from dragging your feet on the ground. This creates a higher fall risk for people who are unable to elevate their toes, and our goal is to try and prevent that. We tend to use a special kind of orthotic called a posterior leaf spring. This is a simple bar that runs the back of your calf and extends forward up into your shoe, allowing you to maintain a more neutral angle. There's a nice amount of flexibility in these kind of leaf springs, which allows you to maintain a little bit more normal movement at the ankle. However, for people who have less stability, we like to use an articulating ankle-foot orthosis or a solid foot orthosis. This wraps from the back of the calf around forward and will allow us to do a couple different things, mostly in preventing us from going in and out. It still does, however, prevent certain forms of drop foot, and if it's articulating, will allow you to roll over in stance and still have a little bit more of a normal gait pattern. On the other hand, some people may experience weakness in the quadriceps, which prevents them from being able to maintain their knee in full extension. Instead of coming from the back, we can create an orthosis that comes from the front, still inside the shoe, preventing a little bit of that drop foot, but also as we start on the ground, pushing the shin backwards into extension. This extended movement can help a little bit if you have some occasional collapse at the knee, but have enough strength to support yourself. Now, every kind of orthosis comes with pros and cons. Different things will be important to consider, especially for a lot of people, the temperature in the area around them. That can help us choose materials and composition, and depending on your history, we might want to be a little bit more specific. Again, some of the best people to ask are physical therapists and orthotists who have worked with issues like this in the past. So if you have any questions, as always, feel free to ask us and we're happy to respond, especially if it comes to deciding if an orthosis is right for you, or if you're having trouble deciding if the one you're using or the choices you have are better for certain options. As always, have a great day.